intuition at work. I'm like, I use my intuition all the time at work, at triage, and it's just patient after patient after patient after patient, and the chairs are never empty, and there's just always so many more people. And so I found myself trying to keep myself entertained. It got to the point where I'm like, I'm going to start guessing. Like, I thought I was just playing a game where I'm going to start guessing what people are coming in with when they present before I actually triage them, before I talk to them. If somebody's holding their chest, well, that's pretty easy. We're going to go with chest pain. If they're holding their abdomen, okay, fine. Just before COVID hit, our manager at the time thought it was going to be a great idea to swap us from a 4-5, so 2 days, 2 nights, 5 off schedule to a continental schedule. So 2 weeks days, 2 weeks nights. But it's horrific. You end up working more hours without being paid OT. Got to the point where I thought, how do you explain to kids that mom chose to continue to go to work, right? We all had the option not to go. We all could have backed out. Everybody did what was right for them at that point. And I chose to continue to go in. Thoughts of, what happens if I die? How do you explain to your kids that you continue to choose to go in? I said, well, let me start writing my stories down. The really good stories where I helped and I did things and I changed somebody. So I started writing those.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hello again, everyone, and welcome back to the Nurse on Purpose podcast, where we aim to challenge media stereotypes of nursing and highlight the incredible work that nurses are doing. Today, I'm so excited. I have with me a one-of-a-kind guest, and I say one-of-a-kind because till date, she's the only one that I've met who is blending a very powerful part of the human experience, which is our intuition, with science and healthcare. Jen Johnson is the intuitive nurse. She's had a very impressive career as an ER nurse for many years. This is where she honed her clinical skills and witnessed firsthand the power of quick, decisive action in life and death situation. But what sets her apart is her focus on intuition, and you guys will get to hear that today. She talks about how it plays a crucial role in nursing and how it can truly save lives. Jen has also written a fascinating book that explores this very topic, guiding nurses to tap into their own intuition with confidence and purpose. And today, we're going to be just talking about what inspired her to prioritize intuition, the challenges that she's faced, and really any remarkable stories from her career where intuition made all the difference. So Jennifer, I am so thrilled to welcome you to the show.
Good morning.
Good morning, Ontario.
Hi, Maryland.
Yeah. Jen is in Ontario, Canada. So we're both freezing our butts off this morning. And we talked about earlier before we started the episode how your kids were like, Mom, do we get to stay home? And you're like, no, we live in Canada. Get on the bus.
Get on the bus. This is the cold. This is you got to develop that thick skin, kids. It starts early. So just get out there. Go.
Yeah, for sure. Like, just go and do it. This is how we roll.
Right.
So today, we're going to be exploring this unique topic. Like I said, it's harnessing the power of intuition in nursing. I want us to discuss how nurses can use their intuition in daily practice, how to recognize and sort of develop your own intuitive skills, and how intuition and scientific research intersect, right? Because everything we do is based on evidence. Data is king. So we want to know how you can kind of blend those two things together without seeming like hocus pocus. So would you just kind of start by telling me how your nursing journey started and how you got to this point of using intuition in the context of nursing practice?
Yeah. So to me, nursing can be a calling, but it definitely was not mine. I fell face first into nursing. It was a one-off. I had started in biology. I finished a year. I got into my second year, failed my first half of organic chemistry, which
Mm,
I'd never failed anything before. So I'm going,
mm,
what now? So
mm.
thankfully had a buddy in first year who was in nursing. And so we'd pour over her Mosby's textbook and we're like, oh my God, look at these color photos. Like, this is cool. Like,
Yeah,
this is
yeah,
awesome.
yeah.
So when it came time to like really look at it, I'm like, this is not biology. I thought it was going to be more than it is, and this isn't what I thought it was going to be. So switched into nursing, thank God, and ended up just kind of flying by the seat of my pants is very
Mm.
much my 100% go-to way of life. And
Yeah.
so met my husband just as I was graduating, moved to a very, very rural town, so less than 5,000 people. It had one RN for the department and one RN and two LVNs or LPNs for the floor. And that was it. That was
Wow.
that was it. That was all. So if anything actually major happened that hit the ER, you were calling in the next shift early, you were doing all these things. So it was super eye-opening. And bullying to start. It just, it starts
Oh.
early. Spent 5 years there, moved down south, back to where kind of my comfort zone is to Southern
Mhm.
Ontario medicine versus Northern rural medicine. And, went from sometimes seeing no patients in 12 hours in the ER up north to 80 to 100 to 120
Oh,
in a
goodness.
24-hour period in down south at the stroke center I was at. So, at triage, and it's just patient after patient after patient after patient, and the chairs are never empty, and there's just always so many more people. And so
Yeah.
I found myself trying to keep myself entertained and interested and trying to keep my skills up. And so it got to the point where I'm like, I'm going to start guessing. Like, I thought I was just playing a game where I'm going to start guessing what people are coming in with when they
Yeah.
present before I actually triage them, before I talk to them. And so if somebody's holding their chest, well, that's pretty easy. We're going to go with
Mhm.
chest pain. If they're holding their abdomen,
Mhm.
okay, fine. Like,
Mhm.
but it got to a point where, you kind of started, okay, I'm going to guess what you're coming in with. Okay, I was wrong. So let's get the full story. What are you here for? And all the things. And I noticed that, ideas would pop into my head about questions I would be asking or should be asking at triage, or ideas about, oh, this is the kind of blood work that I want. And it's a little off what we normally would do for medical, like medical directives and stuff like that. So, why don't I just go with that and kind of see it through? And so my ER docs were super lovely, and they were able to, you build a rapport with them. You're like, hey, can I add on a CK to that blood work, or can I extended lights and a TSH because they're having palpitations? Like, let's just really reach for the stars, because a TSH takes forever and a day to come back. So I'm like, let's just get this started as these poor people wait. And the more often that I would guess, the more often I found that I was kind of being right. And I'm like, okay, like, well, let's ramp this up a little bit. Let me like narrow it down instead of just abdominal pain. Well, now like, oh, is it their gallstone? Like, is it their gallbladder? Is it their pancreas? Or is it appendix? Like, what else is going on? And, you know, I started to kind of hone in more on what I was seeing and what I was feeling versus just simply the story that they were telling. And of course, along with vital signs, and you're going like, I started noticing that I was having this feeling every now and again of a patient would come in, you'd hear the story, you're like, oh, the story's kind of off a little bit, but not crazy. The vitals aren't great, but they're not awful. But you're just like, there's just this sense that something more is going on. Like, I'm missing something, something's brewing. There's just something intangible that I can't put my finger on, but something's up. So I started to like follow those people through their ER visits, and like, okay, now we've had some x-rays and we've had a CT scan, and and all of a sudden they'd crash, or, it turned out to be some, life or death thing where we really had to intervene quickly. I'm like,
Yeah.
oh, holy crap. Like, okay, glad I was paying attention on that one. And
Yeah.
it would cycle through. So you'd have days where it'd just be a typical day. Nothing really would stand out. And then you'd have other days where it's like, you'd literally be walking the halls and pass like all the people in the halls as they're waiting to be seen. And you're walking past somebody and like my feet would stop because I would just glance at somebody and be like, whoa, what is up with this? Like,
Yeah.
what is happening with this picture? I don't understand. I need to know more. This person looks awful. Just something's up. And, you know, we all would talk about it at 3 a.m., you know, little hushed tones, because again, people think it's a little woo woo, it's a little out there. But yet, you know, the doctors describe it as spidey sense, and that's an acceptable term. We call it trusting our gut, or at the very most, you know, just advocating for our patients, and that's acceptable. But the second you throw the word intuition into the mix, everybody goes, whoa, 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 where's the science? And you're like, fair question, but it's there. So it's been crazy getting to this point, but it's been a heck of a ride so far.
That is amazing. You know, you said spidey sense. Some people will say, I just have a, what is it, sixth sense about this? But truly, it does boil down. Exactly, women's intuition. I just know, I just have this feeling inside. I mean, I think that while we use that in our everyday lives, sometimes when we try to transition to use it in our professional lives, we can be met with some challenges because it's like, if it's not, you know, rooted in the science, and if it's not researched over and over, it really just feels like hocus pocus. You know, where's the data to back that up? Right? You know, when did you discover, so you were using this in your kind of daily nursing practice, but when did you discover that intuition was something that really needed to be leveraged in our work as healthcare providers? Like, it needs to be an integral part of the way we manage, the way we assess, the way we diagnose our patients.
Yeah, it's been so gradual that I don't even know if I could really put a finger on it. You know, there was one professor in 4th year who mentioned one time, always trust your gut. And like, that was the end of conversation. It was kind of a one-off topic. And so I'm like, oh, okay. Like, and so that kind of stuck. And had she not said that, I don't know if I would have really given this concept as much gusto as I have. Because it sounds very woo-woo. It sounds very wishy-washy, you know, pattern recognition versus insight versus experience versus intuition. Like, where's the line? How do we bring it in? And so it ended up that when I, you know, finally broke down and started writing, and the common theme that strung through all my stories was this thought of intuition. I'm going, okay, well, that's interesting. It was, you know, August of 2020. The misinformation, disinformation was huge. So I'm like, I would honestly be putting my license at risk almost to put this forward without any science behind it. And so I ended up doing just this huge deep dive into, you know, journals and research and keeping it within the 5-year mark, and, you know, peer-reviewed evidence-based studies and all of this. And the consensus was like, not only is there just so much information and studies on intuition, but like specifically intuition in nursing, which is the funniest thing, because we all talk about it. Anybody with, you know, 5 or more years kind of starts to get that sense that, okay, you know, you're going with it. You're not doubting yourself as much. And you hear other people advocate for their patients like this, where I just don't know. And hey, can you just take a look? It's just something's bugging me, or that. And so you hear other people do this. And so you're kind of learning about it vicariously. Nobody's actually sitting you down and being like, hey, this is a valid way to bring it into your assessments. And obviously it's not going to be the be all end all. It never is. It's going to be in conjunction with everything else. It's going to be in conjunction with your knowledge, skills, and judgment. It's going to be in conjunction with a story. It's going to be in conjunction with vital signs and labs and, you know, test results and all this kind of stuff. But it's something that we all are already doing. It's just, are we giving it any sort of attention, or like, kudos, really, are we recognizing that's happening? And then B, are we deciding to do anything with it? Like, are we actually speaking up and saying anything?
One of my guests has said that nurses are natural MacGyvers, like where Sherlock Holmes is of healthcare. Can you share with me any specific example where your intuition helped you make a critical decision in patient care, or, when lack of following your intuition may have proved costly to you or your patient?
Yeah. I mean, I feel like that's such a great analogy. I feel like MacGyver all the time, where it's just like, oh, how do we make this work? But yeah, probably one of my most memorable, looking back, it was intuition. I didn't realize it at the time, but like I was fresh out of school, was working kind of the med surge half of this very rural little hospital. And so finally get my patients, we've listened to half an hour of taped report, which, aging myself horribly, but like physical cassette that we listened to. So go see my patient. He's a pancreatitis patient, chronic alcohol use. He's been like this for a long, long time. He's been in and out of the hospital constantly. And here we are again with another round of pancreatitis. So I didn't know much about pancreatitis at the time. I'm just like, okay, just so eager and so green. And so go check on my patient, do a set of vitals. I'm talking to him. I'm like, how's your pain? He's like, it's not bad. And then he like literally doubles over in front of me. And I'm like, what is happening here? I'm like, okay. And so he's like, obviously he's in more discomfort now in this instance than he was like 3 seconds prior. I'm like, that's really odd. So, I kind of freaked out. So I repeat the vitals. Obviously vitals are off just a little bit, but not crazy. And I go and call the doc. It's like maybe 7:30 in the morning. Calling the doc. I'm like, hey, you have to come see this guy. Like, I don't know what's going on. And, he's just, all of a sudden he's doubled over and da-da-da. And my doc's going like, oh yeah, he's been in and out constantly. His lipase has been worse before. Don't worry about it. I'm like, okay. I'm like, so hang up the phone. Hour goes by. I repeat my vitals and they continue to trend, heart rate starting to climb up, temperature starting to climb up, BP starting to fall. And I'm like, hadn't had much experience with sepsis at that point. So I'm just like, oh, I don't like this. And every hour I'm repeating vitals. And then I'm calling my doc back. I said, look at like, here are the vitals. Like, I don't know, and continue to like call her every hour on the hour pretty well. And she's, every time I'm calling her, she's getting more and more frustrated with me. She's like, look at, like, it's not a big deal. And then we finally got to a point where his blood pressure was like starting to tip below 100. Systolic. And she goes, give him a 500cc bolus and I'll be there, when I get there. And I'm like, okay, and at least then you're like, okay, now here's something to do and I can do the things and I can get moving and we can fix this. Still had the gloss on that, you can fix everything. And trying to get the bolus done and waiting for her. And so like 11 o'clock rolls around, she finally rolls in. It's still pissed that I've called her all the time. I'm like, oh my God, thanks. You need to come and see the patient right away. And, grab her and pull her in. And she go, oh, okay. Like, he's in some pain. We'll give him some pain meds, 2 of morph, I'm pretty sure. Just like at the time, I'm like, again, whatever, I'll take it. Give him the morphine and, blood pressure obviously comes down a little bit more. And I'm still freaking. I'm like, hey, oh my God, the blood pressure. And she goes, well, it's probably because of the morphine. Like, don't stress about it. Like, whatever. And she keeps putting me off. By, I think, 12:30, we've moved him into our one cardiac room, like the one monitored room that we've got in the entire hospital. And so we're hooking him up. We're now starting dopamine. We're starting norepi because his blood pressure keeps falling. Now he's full on fevered. And by like 1:30 in the afternoon, his heart stopped. We're doing a full resuscitation. And, by 1:45, 2 o'clock, we've called it. And, I'm walking away because I have no idea what's going on. Like, it's one of my first codes, let alone on my patient, which is finally under my license. And did I not, like, all you can do is guilt yourself, right? Like, what did I do? Absolutely. What did I miss? How could I have done more? Why didn't I push harder? All these things. And like, it bothered me for years. And so it wasn't until I left that job, like 5 years later, that physician ended up coming back to me and saying like, oh, I hear you've got another job. I'm like, oh my God, yeah, I'm leaving. See ya. Can't wait to get out of this town. And she goes, don't let anybody tell you you don't know what you're doing. And I was pissed. It's like, you've got to be kidding me, because I know exactly what you're talking about, and you know exactly that. We both know exactly what this is about. And you've waited 5 years to tell me this, and for me to leave. Had I never left, would you have ever told me this? And so I was just like, you've got to be absolutely kidding me. And in that moment, it's just like so much anger, but then so much vindication. And you're like, okay, I do know what I'm doing. I am learning. I am growing. I'm getting through this. But in the meantime, I had to carry the emotional weight of that for 5 years, thinking that it was my fault that he died, which could have been avoided had she just said something earlier.
That is so crazy. When I read that in your book, because you wrote a book.
I did.
And, when I read that, my blood was boiling, because it really, I don't know, but I think it could have been prevented if the situation or your concerns were addressed sooner. And to be a brand new nurse, and for that to happen, you really start to deal with so much self-doubt, guilt, and confusion. You're like, was I even supposed to be in nursing to begin with?
Yeah.
Should I have just called somebody else? What could I have done differently? And taking the physician's word for it, because you're like, all right, well, maybe she does know what she's talking about. After all, I'm the new nurse, right?
Exactly.
So that is, you're thinking, I know the least of everyone here. I should listen and I should kind of stay in my place. But when you see how that can truly impact a person's life and their families, because now their families are grieving for something that could have easily been prevented, that was a great example of why we need to trust our gut. Because what's the worst that can happen? Okay, so say you're wrong. There's no harm, right? No harm, no foul, nothing's.
There actually is. There's science to support it. So you're a new nurse, you're testing it out. You feel like you've got this feeling that something more is going on. You reach out to your doc or to somebody else. The doc says, okay, well, fine. They come and have another touch point on that patient. The science says, even if the patient isn't as sick as you thought they were, because again, you're probably learning what sick, not sick, really sick looks like.
Yeah.
Even the physician just coming and having another touch point on that patient still improves patient outcomes.
Wow.
So you can be wrong, but still improve your patient outcomes. So what is the harm in trying and testing it out and going for it? Like, it takes a lot. Trust me, it takes a lot to kind of come forward and say, like, I don't know, can you help, kind of thing. Yeah. But the science is there, and it's, even if you're wrong, and that's okay, I'm wrong plenty still, 100%, your patient's still going to benefit from it.
That is interesting. And I wonder why. I have a hunch that perhaps you're doing extra assessment. Time spent with a patient can be also emotionally healing and just sort of good for their well-being, to see that there's somebody who is taking care of them.
Yeah. People
decline when they don't feel like they're heard, valued, or seen. And so that might be one. I don't know. I'm just hypothesizing.
We love to do it. That's how we grow. That's how we grow. You throw a hypothesis out there. We've all been there. Yeah. We went through the classes. You throw out a hypothesis. You get the data to support it or not, and you go from there. But you have to come up with a hypothesis to test it first.
Yeah. So that's actually really interesting. So that even if you're wrong, the patient still benefits.
Yeah.
And that's what it's about, right? Patient care.
Yeah.
Thank you for that example. And I'm sure you've had, besides this, your fair share of naysayers or challenges. People, even in the medical field, that will maybe scoff at the idea of using your intuition, because they're like, everyone has an intuition.
Yeah.
But what place does it have
here
at work? So that's got to be difficult. Can you tell me the process of writing that book? Because I want to hear
All
it.
right, let's buckle in. So the process of writing this book, COVID. COVID
Oh, wow.
killed me. Just before COVID hit, our manager at the time thought it was going to be a great idea to swap us from a 4-5, so 2 days, 2 nights, 5 off schedule to a continental schedule. So 2 weeks days, 2 weeks nights. So
Oh,
it's like
wow.
2 on, 2 off, 3 on, 2 off. Like it's every other weekend. It's very fair
Right.
that way with the every other weekend, but it's
Hmm.
horrific. You end up working more hours without being paid
Oh,
OT,
wow.
and
Mhm.
you feel like you're always there. I can't stand a continental schedule. That's just a personal preference. But she
Yeah.
swapped the schedule, and then COVID hit. So my kids were 4 and 5.5 at the time that everything shut down. No
Mm.
daycare. My husband was also essential, so he had to go to work. So he was Monday to
Mm.
Friday, 8 to 4. So
Mm.
I had to try and make it work. And, so I'd swap to straight nights, and I would stay up all day with kids because you can't actually leave them alone because they're
Right.
monsters and they just run around and are
Yeah.
crazy and they destroy the place and they actually get into all
Change
the
the
things.
color of your house.
Ugh, poop in the corners and like all the things.
That's funny.
And so you actually had to kind of keep eyes on them. And then I'd stay
Yeah.
up all night at work. And then I'd come home and stay up all day with the kids. And then I'd come home, I'd go to work and stay up all night. And it was, 6 weeks of this before there was any sort of anything started to open up. But really, it was like 3 months here at least before daycares opened back up. So
Right.
I was out of my mind. I was completely
Wow.
sleep deprived. I was depressed and anxious and fearful, and again, all the feelings that we all had
Yeah.
going into COVID because we all had no idea what was going to go on or what was happening.
Absolutely.
Policies changing morning to afternoon to night, like you had no idea. There was no predicting anything, and then throw
Absolutely.
in sleep deprivation. And, if I thought I'd ever been burned out before, holy crap, was I wrong. And so, like, completely out of my mind. And it got to the point where everybody was volunteering and offering services, and the food was endless and whatever else. So we had a bunch of lawyers that had come forward very early on in COVID to say, like, hey, all the essential workers, we appreciate you so much. We want to do everybody's wills for free.
Wow.
So we all kind of looked at each other and went, oh, we're really not expected to survive this. Like, great.
Wow.
Like, I understand that it's a very much necessary thing to do. And especially because
Mhm.
we have kids, but like, it hits you so hard that like, oh my
In that
God, we may actually die.
yes.
Like this may
Yeah.
actually be it. And, then throw that into the burnout mix. And it got to the point where I thought, how do you explain to kids that mom chose to continue to go to work, right? We all had the option not to go. We all could have backed out, everybody did what was right for them at that point. And I chose to continue to go in. And, the thoughts of, what happens if I die? How do you explain to your kids that you continue to choose to go in? I said, well, let me start writing my stories down. The really good stories where I helped and I did things and I changed somebody and whatever else. So I started writing those. Fun fact, those were very few and far in between. Very quickly, all of the unprocessed trauma from the last like 12, 13 years of ER nursing came flooding out. And it was all these stories about patient deaths and worry and fear and anxiety and all these feelings that I didn't know I hadn't dealt with because we all just shove them down deep and keep on moving. And so they all came flooding back up. And I thought, okay, well, I'm going to write them. If they're coming up, it's for a reason. So I'm going to write them down and I'm going to really sit in them. And like, do I hear the dinging? How cold was it? What room were we in? What hospital was I in? Who was there? Can I actually sit myself back down into those, moments and relive them, which I hadn't. And it ended up being super cathartic to write all this down. And it was when I was listening to Llewellyn, who's a publisher out of the US. They're into metaphysical and spiritual books, and they were having online book fairs. And so the authors would talk about their books, and everybody could like listen in for half an hour to an hour. And the one book was Intuition at Work. And so this author was talking about her book, Intuition at Work. And I'm like, Intuition at Work? I'm like, I use my intuition all the time at work. And it was just an instant snap. And I'm like, holy shit, that's it. That's everything. So I went back in and looked at all my stories. And sure enough, here was a thread of intuition through every single one of these stories that I would relive countless times, because we use them as teaching opportunities for other people. And it was the intuition piece that stuck. That's why these stories stuck. And so I thought, okay, well, again, I'm going to risk my license if I just put this out there. So did the deep dive, and to learn that it was supported by evidence was just so vindicating. Because, here I thought I was just goofing off. I thought I was just playing a game. And here it's the science. And,
real,
we all say if it's evidence-based and it's backed by science, we should be teaching it. So I thought, here, I'm just gonna like jump on the spear over here, and I'll be the one to say it out loud in front of everybody, write the book, put it out there. And if nothing else, just get people talking.
I'm sure there are new nurses who are also looking to sort of hone that gut feeling that they have, but are afraid to do that because they feel like, I'm new. I don't want to rock the boat. I just want to stay in my role and stay in my place.
Yep. You want to stay in your lane, right?
You want to stay in your lane. And what if they're wrong? And we've already talked about, even if you're wrong, there's still benefit to the patient. Mm-hmm. But if honing intuition is meant for the workplace, right? Then how can we teach nursing schools or help nursing schools to train their students to, kind of incorporate their own intuition into their practice when they become nurses? How can nursing schools incorporate the idea or the science behind intuition into their curriculum so that nursing students can begin to develop their own intuitive skills?
Yeah. Fun fact, we've already got the skills. Any woman, especially over the age of 12, we know the creep factor. We know the ick. We've been there. We've been in situations where all of a sudden the hair on the back of your neck stands up and you go, oh, I'm in danger. And it's because it's related to our own safety and our own well-being that we just listen and we go with it and we trust it implicitly. And it's never a question as to, should I be listening to this? It's never once been a question.
Right.
But to take that feeling and then have it be related to somebody else, it's just a little bit harder, right? Because it's not an instinctive, my safety, it's their safety and their wellness and their well-being. And sometimes I like to think about it, everybody's always trying to relate everything back to resilience. And if I never am called resilient again, it will be too soon. But so in the situation that I had with my pancreatitis guy, had my intuition been listened to early on, he may have gotten antibiotics early on. We may have been able to fly him out. He may have gotten surgery. I'm pretty sure what ended up happening was a bowel perforation. That's my estimated guess at this point in my life. We were 2 hours away from a major surgical center. So had things changed, maybe not. But had we been able to do something, had he improved enough to go out, had we been able to save him, I wouldn't have had 5 years of that weight to carry around. And so for every patient that there's an adverse outcome, the nurses are carrying a piece of it. I can guarantee you. And the younger you are, the newer you are to nursing, the harder those hit. And it takes a long time to build up that, okay, I can't save the world. I'm not going to be able to save everybody. Death is a natural thing. It happens. It's not the enemy. That kind of mindset, it takes a really long time to get there, because in nursing school, you can save everybody. You're going to change the world. You're going to save everybody. And that's what we're taught. Whereas then reality, slaps you across the face and you go, oh, okay, this is a whole different ball game. So now I'm having to change my mindset. But if you can teach people to, trust their gut, use their intuition, recognize changing clinical symptoms sooner, and and get reassessments sooner, then we can start antibiotics sooner, get pressors started, get ICU involved if need be, call a rapid response. You know,
Yeah.
your patient's changing, you don't know what's going on, call rapid response. And my ultimate dream would be for every rapid response team that comes and swoops in and stabilizes the patient and either stabilizes them and keep them there or take them to ICU. I want another nurse to come back and be there for the nurse who called rapid response. I want there to be a nurse going through that scenario with that nurse to be like, listen, you did a great job. These are all the things you did right. This is how we could learn. You know, let's debrief a little bit. Let's take some time for you. Let's step away for half a second so that maybe you can eat or pee or like get your mind about you. And then let me help you stabilize your other patients, because we all know that the other 7 to 8 to 20 patients that you've got in the waiting room or in the background have been neglected while this other critical person's been being dealt with. Let's get those people sorted. Let's make sure that you're okay. And let's teach you when this happens, because we all learn best when it's in the scenario that it's happening. We all can talk about, scenarios in hypotheticals all day long. But when it's happening to you, you're going to learn. And then you are going to teach others on the floor without realizing that you're doing it, because you're going to share that story.
Absolutely.
And then everybody learns. That's my dream.
And that strikes me. Yeah, I love that. And that's something you didn't get. So you have such a passion, in that first scenario, at least, you didn't get that. You didn't get that, after post event support. First of all, I guess it was a small hospital. There are already only 2 doctors. There's one. So the family docs cover emerge, and so then the family docs will come in and obviously care for their own patients who get admitted. But it's not like a lot's going on most days. Most people have been there for 45 days plus. That's a new. I don't know if it's new, but it sounds like a kind of a game-changing initiative, right? Like support after the rapid rescue, after the codes. What do we do to support the mental health of our healthcare workers who were right there on the front lines of coding that patient, of probably watching that patient pass away in the moment? What can you do to support them right away? I know that hospitals now have counseling for their staff, but right in that moment, how can they benefit? It's not good enough that they go right back to work and go right back to doing just their day-to-day life. And so it's so important, that self-care. So you should start that. That should be your business.
I subscribe to the Nursing Beat. So it's a daily email that highlights all the sorts of different nursing news and things that go on every single day. And I actually just read one this morning that it was the, oh my God, what was the name of it? Sorry. I want to get the wording right, because honestly, it was just the coolest. And I'm just like, oh my God. Nurse retentionists.
Oh.
So these are nurses whose sole purpose is to make sure that your nurses are happy and thriving and growing. That is their sole purpose. And I'm like, you want to talk game changing? I would love to do that. I would absolutely love to do that. So they take
care of the nurses so that the nurses can take care of the patients and everyone thrives.
What a concept. Oh my God.
What a concept.
What a concept. Nurses need care? No. No, they can just shove it all deep down. It's fine. We'll move on to the next.
For 18 years, and then it comes out in COVID.
But she gets a book out of it. What's she complaining about? I don't know.
Yeah, well, still, we don't all want to get books that way. No. After trauma, after 18 years of trauma.
Oh my God. The ongoing joke is, if I ever need a new therapist, I'll just hand them the book and be like, so this is volume 1 of why I am the way I am. Here you go. I'm going to save about $5,000 of us talking back and forth. I'm just going to put this in front of you.
I love it. But that is, I mean, that's brilliant. And the Taylor, who
I love
is our
her.
mutual connection,
Yeah.
and that's kind of how we met.
Yeah.
Because she recommended you as a guest on the show. That's her entire sort of like concept, and her mission is to help heal all the burnout and the emotional fatigue that nurses face on a daily basis, so that we can actually stay in the profession,
Yeah.
so that we can take care of patients better. So you both align on that mission, what you should.
She is a rock star.
Yes,
And so
yes.
she's actually bought a bunch of my journals to put in her wellness boxes. So we've collabed a little bit already, and I can't wait to
Awesome.
work with her more, because she's just the
She's
best.
sweet.
Like, such
She
good
is the
people.
best.
Such good
She
people.
loves, she genuinely loves people and
Yeah.
loves nurses, which, it's different. I'll say that. And I'll leave
We're
it there.
very high. We're high maintenance.
I'm not sure I see that. You guys are
I'm high
super
maintenance,
easy.
as in my husband can't predict what mood I'm in, as in, like,
Oh,
do
okay,
not
okay,
talk to
okay.
me, versus like, oh
Yeah.
my God, like, why don't you ask me about my day? I can't understand.
Yeah, yeah. Oh man, our poor husbands. They
Poor
just,
husband.
they have to deal with it all.
This is what they get. They
They,
signed up for it, kind of.
yeah, they signed up
He
for
didn't
it.
really know that he was going to get this, but
I'm sure he's delighted.
I almost spat it out. He is a rock star who has been there through absolutely everything. So, and he has yet to fully read the book. So I'm like, listen, if anybody understands exactly what's happened, you're the only person who's been there this whole time. So please read the book. Just read the book.
Yeah. He's like, I experienced it. Why do I have to read it?
I'm pretty sure that's where he's going. He's like, why do I have to relive this? Yeah, I don't want to relive this. You relived it for the both of us. So I don't want to relive it.
Yeah. So I think that, this is such a great point where we can talk about more of the media portrayals of nursing. Because, that's my passion.
Absolutely.
And that's what I love to talk about. So do you watch any shows? And if you do, and by shows, I mean like medical dramas or just anything. I mean, if you watch TV at all, really, do you have any thoughts about how nurses are portrayed in media?
Yeah.
Please share.
So Grey's Anatomy, when I swapped into nursing, that was the first year that Grey's Anatomy came on. So I've got this very complicated relationship with Grey's Anatomy, because it's been there through my entire education, through my entire career. It's always been there. It's been like a constant. And so to watch it and have there be one nurse who's been there the whole time, never uttered a word. She has had 0 lines. There are fan clubs dedicated to this lovely woman, and she's an OR nurse in real life.
She's a real nurse.
She's a real nurse. Has had not one word in 20 odd seasons. And you're like, are you kidding me right now? And the only other time that they had a nurse on, she was the one who hooked up with the different interns and gave George syphilis from Karev. And you're just like, really? We had to go that route, did we? So it wasn't, obviously it was for drama factor, but at the same time, you're just like, seriously, like, we are so much more than just like bit players. Like, we are main characters. So main characters. I love Nurse Jackie. I loved that it was a very different take on a very real issue. With substance abuse and the weight, the mental weight of nursing. Love that. I'm watching St. Dennis right now, which is kind of your comedy office take on hospitals, which is super funny. Somebody, oh my God, the Liberated Entrepreneur, I think, she's from Australia, and her and I got chit-chatting, and she introduced me to Chicago Med. So
Oh, yeah.
I'm like, okay, quite enjoy Chicago Med. And, you know, and
That's
the
a good
Pit.
one.
The Pit.
That's a new one
Oh, it's
on
so
HBO Max. Yeah.
it's on Crave
I
too,
started.
apparently. I get it off of Crave, so maybe that's a Canadian thing.
Oh, okay.
But
Yeah, we have HBO Max over here. That's
yeah,
where I watched that one.
it's so good. I can't
Yeah.
even. And again, being a career ER nurse, having them,
Yeah.
you know, make sure you listen to the nurses. You know, the nurse is the
Mhm.
one
Mhm.
driving the show,
Mhm.
and everybody's got their
Mhm. Mhm.
opinions. And there was
Yeah.
one very quick scene where it was like, oh, you know, I did this abdominal workup on this guy, and the nurse goes, oh, hey, by the way, do you want an ECG because it could be a cardiac,
Yeah.
da da da. And sure enough, he had
Absolutely.
this massive MI, and the nurse caught
Oh,
it, but
wow.
it was glazed over.
Yeah.
The intern got the win, but it was the nurse that suggested it. And you know, I remember starting my career, and you know, again, 12 hours would go by up north and nobody would come into emerge. It was the weirdest thing, but like you watch the minutes tick away, and you felt like your life was slowly draining away from you. So I watched ER, like reruns of ER, like in the hospital. It was so much
You're
fun.
like a major medical drama
I
geek.
love them because again, it's also super fun to then be like, you've got to be kidding me, and just tear it to shreds. You
Yeah,
know,
and your husband is like, that's what you guys do all day is
oh,
just, walk around and look pretty and wipe butts.
so he used to be a paramedic, and so he knows better. And he's there was a point where we actually worked in the same hospital, so he would come down to the ER
that's
and
good.
do his infection control stuff, and he'd see me,
Okay.
and you know, he'd see the chaos. So like he
Oh,
kind of understands. However, love him. However, shift work.
he's onto them too.
He doesn't understand the shift work anymore. He did work shift work, but he got to sleep on his night shifts, the whole night shift. I, however, do not get to sleep my entire night shift. I get, you know, maybe an hour or two if I'm super lucky. And so for him to like use Alexa to wake me up at 2 a.m. or my 2 a.m., his 2 p.m. Hey, can you go get the mail and send this thing and da da da? I'm like, I'm gonna murder you. I'm just like, do you understand how like it feels like I just got to sleep. I've only got a couple more hours before I have to go back in again. You're joking.
Yeah.
You're kidding, right? So he should know better.
Yeah.
And now that I'm straight nights, it's, you know, where it's like 2 shifts passing in the night because again, no daycare. The kids are 9 and 10 and a half now. So like they're so close to being semi-independent, but we're not quite there yet.
Well, you have a busy life. I understand.
That's not even the entrepreneur side.
Yeah, we are constantly moving.
Honestly.
It's crazy. But hey, we've got to do what we've got to do.
We make it
because
work.
the higher call is not going to wait. It's, so we've got to answer it. And that's what it's about. Following your intuition.
Absolutely.
I have loved talking about this topic with you. We're going to play our game. Are you ready? Are you ready? Are you ready? Are you ready? Okay, let's do it. So you know how this goes. Here's my jar, my goodie bag, my jar of tricks.
Do it.
Yeah, we're going to pick a category, and then you're going to write your own TV show, movie, depending on what I pick out of this jar. Are you ready for it?
Let's go.
Okay, guys, let's do it. I'm not going to cheat, so. Okay. Ready?
Was it?
Comedy! My category is comedy, Jen. I'm not kidding.
There you go.
I was just saying, Holly, you're so funny. So your category is comedy.
All right. You take your nurse CEOs, or you take your CEOs in general, who may not be nurses.
Yeah.
They do a body swap with a new grad nurse.
Wow.
And they work the ER only on full moons and holiday weekends and night shifts.
Oh,
Friday
goodness.
the 13th and Halloween. and
my
they fumble trying to think that they know what they thought nurses did, and they get a very rude awakening, and it is just mishap after mishap after mishap after mishap, and then the heartwarming, we've made a difference in a patient, and now we can grow, and now mishaps again, and mishaps and mishaps, and like a take on Scrubs, but with nurses, with this like CEO body swap. Because honestly, they've asked me before, what can nurse leaders do to like support their staff? And I'm like, honestly, be present. Be present, be on the floor. If I don't know what your face looks like, then how are you going to help me?
That's amazing. That is quite a show. I would totally watch that show. And I'm saying you and Taylor are like twins because she even talked about something similar. You both share that vision to empower, help, support nurses. You're both rock stars. So glad to have spoken with you today. And if you could pick someone to be on the show as a guest, who would it be?
So many. My personal hero is Tilda Shaloff, Shalof. She's an ICU nurse out of Toronto, Ontario. She's written several books. Her first, The Making of a Nurse, is just so impactful. And when I was just starting out and I was overwhelmed and I thought, I can't do this anymore, there was one page in her book that listed a bunch of, medical practices and skills and stuff. I'm like, oh my God, okay, I can do that one, I can do that one, I can do that one, that one. Okay, okay, if I can do it because she's an ICU nurse, I can do this. I can do this. And that book saved me so many times. I've reread it countless times. I've reached out to her. She's read my book. She loved it. And now she's like, you've got more books in you. And I'm like, stop. Can we get done with the first one first before the next one's come out? But Tilda is absolutely phenomenal. Rock star. Jean Ross is fantastic. Rebecca Love is always so interesting. Honestly, so I went to health with 30 nurse-led businesses. And so when people ask me for references, I'm like, oh my God, like I've got like at least 30 people that I know that I got to hang out with in Vegas and learn about their like actual innovations and all this great stuff. And it's wild. It's an absolute, get on LinkedIn, come join the nurse gang. Cause like LinkedIn is such a different feel than bedside. Trust me.
Powerful community there. Yeah. Oh yeah, for sure.
It's huge.
So Tilda Shaloff, if you're listening, I'm going to reach out to you. I like to ask these questions because I feel like if I connect with you, then I'm most likely going to connect with whoever you recommend. Because I like to have people on the show whose values align with mine. And that's kind of how I've been running things so far. So I'm going to reach out to Tilda Shaloff. So thanks for that recommendation.
She is older and she's retired. And so I don't know how much she's doing, but I know that she's always got another book in the works. So she's been traditionally published, which is a huge deal. So highly recommend.
That's amazing. And even if it's not for the podcast, just to make her acquaintance would be wonderful. Okay, guys, so we have come to the end of our episode. Thank you so much, Jen, for gracing this podcast. It's been such an honor to have you here. Guys, Jen wrote a book called Nursing Intuition, How to Trust Your Gut, Save Your Sanity, and Survive Your Career, and it's on Amazon. Please patronize her, show her some love in the comments, and just, I hope she has inspired you to live a life of purpose and dare to color outside the lines. And thank you guys again for watching. Until next time, bye-bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.